Hello, my name is Nurse Ellie and I will be doing your neuro assessment today. Can I have you tell me your name?
Omar,
And what is your date of birth?
3/12/07,
Okay, and when was the last vision exam, Omar?
like 6 months ago.
Do you currently wear eyeglasses or contact lenses?
No.
Okay. It is part of a health promotion as a provider to let you know that a yearly eye exam is recommended for good vision. And some people will do it every 2 years for eyeglasses, but it's recommended yearly. So I'm going to begin by doing a neuro assessment with the 12 cranial nerves. I'm going to begin with the optic nerve,
Okay.
or I'm sorry, the olfactory nerve. And I want you to tell me what you smell.
Alcohol.
Okay, on this side.
Alcohol.
Okay. Now, I'm going to now test your optic nerve with a light. This is cranial nerve number 2. And this will tell me if there's any nerve damage behind the optic nerve. Good. Okay. The next cranial nerves that I will be testing are cranial nerves number 3, 4, and 6. Cranial number 3 will tell me as you gaze with the pen I'm going to be showing you this moment. And the trochlear nerve, which is number 4, and the abducens, which is number 6. So you can look closely. Okay. I'm going to test for eye movement, the muscles of the eye. Good. Okay. Now I'm going to test for cranial nerve number 5, which is the trigeminal nerve. I'm going to ask you to clench your mouth tight. Okay, good. Now I'm going to test for cranial nerve number 7, which is a facial nerve. I'm going to ask you to squeeze your eyes shut, and I'm going to place my hand above one eye and raise the eyebrow. Good. Now on the other side. Good. And now I'm going to test for cranial nerve number 8, which is the acoustic nerve. I'm going to whisper, and you're going to tell me the number or the letter that I'm going to whisper. Okay. On the other side.
Hate.
Okay. Now, cranial nerve number 9 is your glossopharyngeal nerve. And I'm going to test that by asking you to open your mouth. And this is going to test for the gag reflex. And you just said ah, which was cranial nerve number 10. When you said ah. Now I'm going to test for cranial number 11. Can you shrug your shoulders up? Now I'm going to ask you to push resistance against my hands. Thank you. And cranial nerve number 12, I'm going to ask you to open your mouth and pull your tongue out. Now push resistance against this. And this one. On top. Good. Okay. Thank you. Now I am going to ask you to please stand up. And this is, I'm testing now your walking gaze and how you will move your ambulatory. Now please walk back. Okay, good. Now can you walk heel to toe? Okay. Again. That's the tandem walk. Okay, now we can get closer to here. I'm going to ask you now to turn around facing that way. Stand still with your hands to your side, your arms to your side. Good. And now, can you close your eyes? And this is just testing for any movement of you moving, swaying, or back, forth. And there's none of that. Okay, good. Now, if you can turn around for me. Come closer. I'm going to ask you if once I do this tuning fork, it's to hear for the auditory nerve on your left side and on your right side. Okay, I'm going to hit this and you're gonna tell me when you stop hearing the vibration.
Stop.
Okay, on this side. Okay, now I am going to ask for you to tell me what you feel with this perception object. Please tell me if it's painful or soft. Come closer.
Painful. 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 Painful.
Okay, how about here above the thigh?
Painful. Painful.
Okay, now, how about this?
Soft. 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 Soft.
Okay. Now, if I can have you hold your hands out for me. Look up straight at me. And please tell me what I'm doing. If I'm pulling up or down.
Up. Down. Up. Down.
Okay. Now if you can turn your hands over. Now tell me the letter or the number that I will be drawing in to your hand, the palm of your hand.
6.
Look straight at me.
8.
Okay, I'm going to do it one more time. Look straight at me.
7.
This is for perception.
18.
Okay. Now, if you can discriminate with this finger. Okay. Now, I need to do, this is, I would normally use a hammer, but this is plastic, this ruler, so this is going to test the bicep reflex. Okay, so you can step closer to me, right there. Okay. Tricep. Brachioradial. You can sit for me here. I'm going to do the patellar reflex. Okay, you can push the chair up higher so your legs kind of dangle. Okay. Okay, now on this side. Okay, good. Now, what I'm going to do is ask for you to sit back and give me your leg up. You can kick your shoes off. Now, if you can, I'm going to test for the plantar reflex here. Your toe should curve to the down. Good. The other one. Okay, now I'm gonna ask you if you can lay down over in the exam bed this way. And I'm going to check for the abdominal reflexes here. So with the stroke, I'm gonna check the 4 quadrants. Okay, good. Now I'm going to check for the other things, which is the Achilles tendon, or I'm gonna check for the Achilles to see if there's a reflex. Okay, so we left here with the Achilles tendon. I'm going to check and see. I can rise this up. Raise your leg up. Achilles tendon would be there. And Achilles tendon. Okay, now I'm going to check for ankle clonus. Leg up. And now I'm going to, and you leave it in the air as I'm pushing. Okay.